Hello everyone, nice to meet you. My name is Takehiko Koga from Fukuoka University in Japan. Today I would like to talk about our study published in GIE entitled Feasibility and Safety of EUS-guided in Inexperienced Centers, a multi-center study in Southwest Japan. First, I'd like to talk about the circumstances that led us to start this research. They are members of the Fukuoka University Hospital Pancreatic Biliary team. Our team was formed in 2020 and started ESBD in 2021. In 2021, in the second case of ESHGS, an adverse event of stent migration occurred during procedure. This was a very shocking event for us and reminded us of the difficulty of the ESBD procedure in centers with little experience. In the past, Villa et al. Reported on the result of facilities with little experience of ESBD in 2012. The technical success rate was low, and adverse events were frequent at facilities with little experience. More than 10 years have passed since this report. However, during this time, no large-scale studies were conducted on the initial experience of ESBD. Reports on ESBD are increasing year by year, and it was thought that even in facilities with little experience, there is a possibility that ESBD outcomes are improving. This is why we have decided to conduct a large-scale survey on initial experience with ESBD in recent years. The aim of this study was to clarify the feasibility and safety of ESBD in inexperienced centers and to determine the current status of ESBD. Methods. Study design was a multi-center retrospective study. 22 facilities in Kyushu and Yamaguchi, Japan, that introduced ESBD between 2017 and 2022 participated in this study. The study included the first 20 patients at each facility who underwent ESBD. The primary outcomes were technical success and AE rates. The secondary outcomes are factors associated with technical failure and procedure-related AEs. Results: 255 cases were enrolled from 22 facilities. A total of 84 endoscopists were involved in the EUS-guided procedure. This is a table of the patient characteristics. The median age was 74 years. Biliary obstruction was most commonly caused by biliary cancer. Ascites was observed in 25% of cases. 12 of patients were receiving antithrombotic therapy. The most common indication for performing ESBD was duodenal invasion. This is a table of the outcomes of the EUS-guided. The technical success rate for EUS-HGS, HDS, CDS, rendezvous, and GBD was around 90% for all procedures. The total technical success rate was 91%, with adverse events occurring in 10% of cases. Clinical success in 86% of cases, and the procedure time was 44 minutes. This is table summarizing the details of adverse events. In total, 6 cases of severe adverse events were observed. 1 case of perforation, 2 cases of stent migration, and 3 cases of peritonitis were observed. And of these, 1 case of death due to perioperative peritonitis was observed. This is a table of the devices used. The combination of 90-gauge needle and 0.025-inch guide wires accounted for 90% of the cases. There were no cases of using 0.035-inch guide wires for the first choice. In terms of tract dilation, the use of electrocautery dilators was low, and blunt dilation such as mechanical and balloon dilations was the main technique. The use of metal stents was about 10% higher than that of plastic stents. This is a flow diagram for technical process of EUS-BD and the timing of technical failure. The most common failures were related to the manipulation of the guide wire, such as inserting the guide wire into the puncture needle, deep insertion into the bile duct, and migration of the guide wire during the procedure. Tract dilation failure was the next most common. This table shows factors associated with the technical failure of EUS-BD. The proportion of cases with a puncture target diameter of less than 5 mm was significantly higher in technical failure cases than that in successful cases. Multivariate analysis identified that a puncture target diameter of less than 5 mm was an independent risk factor for technical failure. This table shows factors associated with procedural-related AEs. The proportion of patients with moderate or severe ascites was significantly higher in the AE group than in the non-AE group. Additionally, multivariate analysis identified moderate or severe ascites as an independent risk factor for procedure-related AEs. In summary, the technical success rate for EUS-BD of inexperienced centers was 91%, and adverse events were observed in 10% cases. Compared to the early days of EUS-BD, the procedural outcomes of less experienced centers had greatly improved. The risk factor for technical failure and puncture target diameter of 5 mm or less, and the risk factor for adverse events was moderate or severe ascites. Conclusion: the procedural outcomes of EUS-BD in inexperienced centers are comparable to those in high-volume centers. The findings of this study will help better understand the status of EUS-BD among current biliary drainage procedures. Thank you for your kind attention.
待って待って待って待って